let us get started. So I would like to start with Shane Downey. So Shane Downey, MPhil, is our partner investigator from Allianz Partners Australia. So I have known Shane for many, many years. He has led big teams and won many awards in data quality management. So a true champion of good data and using data for public good, and has 20 years plus experience in government, in banking, insurance, in health, in retail, in manufacturing. So, Shane, what would you like to tell us about research careers in industry and government?
Hello, everybody. I guess within our organisation globally, we accept and adopt as much research as we can. Very entrepreneurial spirit. Within my team, we have a data science function. We've had a former PhD student from University of Queensland work for us for about 7 years, implementing things like automated claims processing engines, using some ML techniques, some custom OCR, document management, scanning solutions to look for fraudulent claims, and doing things like dynamic customer matching for different activities. So things like chatbots and those kind of things. We're getting more involved in assisted medical triaging using AI as well. So it's a really important aspect of our organisation, and it all stems from you guys, right? It's all coming from research students, from PhDs, and the tools and the techniques that you learn and develop through your time in your course. For me, I completed an MPhil here last year. That was 4 years part-time. I rode through COVID, which was an interesting time, and many of you may have experienced that as well. And still looking to continue my journey to continue into PhD in the years to come. As a lifelong learner, I think it's personally it's important to me, and it's helping me kind of change the way that I frame the way I work, and using literature and using science a whole lot more in business than perhaps I would have in the past. So it's a critical part of what we do as an organisation, but it's also had a big impact on me and the way I work as well.
Thank you, Shane, and particularly thank you for all those examples. We just had a big tutorial on graph data processing, and many of those examples were actually being mentioned, like fraud detection, e-commerce, and also with respect to social networks. So a lot of the customer base, very large customer base, it's like that. So it would be great to sort of mentally connect the dots between the kind of activities, business activities that are happening in the insurance sector that Shane is mentioning, and the kind of techniques that were mentioned in the tutorials, today and yesterday. So let us move to Associate Professor Kristen Gibbons. So Kristen is actually from epidemiology and is working with the Child Health Research Centre here at the University of Queensland, wearing multiple hats, both in academia as well as in government. And yeah, I had the privilege of actually sitting in a few meetings with Kristen and her team. And even though your domain expertise with respect to pediatric health is brilliant, a lot of the language that was coming from Kristen was for those of you coming from a computer science background or a data science background, that was our language. So I was blown away by how the work that computer science and data science is doing is absolutely proliferated into so many sectors, and particularly rewarding to see it in pediatric health. So Kristen, please share your experiences and your insights.
Sure, and thanks, Shazia, for those kind words. Hi, everyone. I'm Kristen Gibbons. I work at UQ in the Child Health Research Centre, but also as the Deputy Chair of a Human Research Ethics Committee at Metro South Health, which is the largest in Queensland, as well as working very closely with the Queensland Children's Hospital Paediatric Intensive Care Unit. So my pathway to where I am at the moment has come through probably some similar ones that you've experienced. So I have background in double degrees in maths and IT, PhD in biostatistics, and then some other grad dips and things along the way. So I wanted to highlight, I think, say one of our key projects and where the skill sets that you all possess can have a huge impact on the health of not just paediatric patients, not just kids, which is where I work in, but globally across the health of our population. And so today, probably majority of you are not aware, it's relatively domain specific to us, is World Sepsis Day. And so World Sepsis Day highlights the importance of diagnosing and early treatment of sepsis, which is a severe infection that can quickly lead to death. And so globally, a child dies from sepsis every 10 seconds, pretty full on, 3 million deaths a year. It causes more deaths than leukemia, than road accidents, and it's a huge global problem, huge global burden. And so we work together with our partners at Queensland Health in Brazil, in Switzerland, in Korea, and India to research ways that we can improve the treatment, the diagnosis, and the management of sepsis. And so I'm really privileged to have come from a data science, from a statistics background, and be so heavily involved in improving the lives of the next generation of children. And so these are, I think, some of the things that I would love to see this amazing cohort of students really consider as a potential pathway. Once you, I think, are exposed to the incredible change you can facilitate and be a part of working in the health field with a non-health related background, it's pretty addictive. I think you might be have a similar view on that. And so I would really encourage you to explore the range of options that may be of interest to you, and maybe the non-traditional space. This may be a little more non-traditional, I guess, than what a lot of data science students go into. But we know that our hospitals, our health services generate huge amounts of data. It's the next frontier for us. We have grants in machine learning, globally. It's been recognised as a priority area for the Australian New Zealand Intensive Care Society. I'm the chair of that data science group as a non-clinician, the vice chair of the national group in just the paediatric study group, the first time a non-clinician's been on that office bearer group. And so I think from my perspective of working with people who are motivated to improve the lives of our children, they're recognising the importance of data science in our field, and they're recognising that we have a huge amount to offer. And so I would like to encourage you to ride that wave with me, come along, join the data science field in the way that we can improve the health of our children, our babies, our families, our parents, our kids, our sisters, our brothers, and really look into that area as something that you'll be able to potentially utilise your incredible skill sets for.
Thank you so much, Kristen. And I'd just like to pick up on that one particular point, it's a pretty heavy workload that you're carrying with all those leadership positions, but it is a flag. It is an indicator of the recognition of skill sets that data scientists and computer scientists bring. So typically these would have been headed by clinicians or domain experts, as we like to call them, whether we are in insurance or health or in other sectors. But now we can see that there is a recognition that the skill sets that computer scientists, data scientists, people who are able to create resilience in their data pipelines, right, are immensely valued. So thank you for making that point. Okay, I would now like to introduce Maciej. Maciej is currently the head of research at Kelsen, but he carries a very long portfolio of involvements and associations, both here in Australia and overseas. and particularly of interest, I think your interest is in machine learning, uncertainty quantification, data drift. We heard about change and the opportunities and the challenges of understanding change in the data and the phenomena that the data represents and how that can be used to improve our data practices. So Maciej's been doing that for many, many years and works in a range of areas, in genomics in particular, but also in cancer research. So Maciej.
Thank you. I actually wanted to come back to that point. I think this is, it is pivotal because now everything is about data, right? And we can't move forward without data. And it just is prevalent everywhere, and it's actually affecting all of aspects of our lives that it didn't before. So previously we would have done a lot of those things manually, and that's why it was okay with domain experts to kind of continuously just drive that. But now, because everything is digital, everything is data, everything is moving forward in that direction, we need data scientists. We need to have people who know how to do it, optimize it, minimize the costs, time, and also minimize the risk of wrong predictions. I think there is nothing worse, particularly in healthcare, but of course in all other critical sectors. But, at the forefront of my mind when I'm working is, whatever we develop, if we make the wrong prediction and it has a negative impact on the patient, that's something that we'll have to carry as our, burden our consciousness. But that's nothing to what will happen to that patient. So, it is super important to have people that they know what they're doing. And I think as we're moving forward, all of the teams and become more and more diverse in terms of the backgrounds and the skills. I think an interesting thing that I wanted to kind of point out is that what you do right now doesn't have to be what you will be doing in 10 or 20 years. I think learning is a discovery, and the discovery not about the world, but also about yourself. And as you progress, you learn more about the world, but also about yourself. And as you do that, you kind of find pivotal points where you might switch. I didn't start education or higher education until I was about 29. So I did my undergrad started my undergrad when I was 29. And my first undergrad was in psychology. But I ended up being, statistical geneticist. I had extensive experience in agent-based modeling, multi-agent systems, machine learning, and went through all of that. And currently my position, what's even more interesting is I work in cancer genomics with a team, but I also supervise a team of quantum physicists because we're applying machine learning to quantum computers, trying to improve the hardware, utilizing machine learning to improve the hardware or development of. So you never know what's around the corner, and you never know what challenges you'll have to face. But if you're curious and if you follow your heart and your interests, whatever tickles your fancy, you can do. Right? People often panic because they have to make a decision and says, what do I choose, this or that? And then they panic. But you can do both. Life is long. It's not very long, but it's long enough. So just relax, enjoy whatever you choose. And if you don't enjoy it, you move on to the next one. Nothing's lost. Everything is gained. Everything teaches you something.
Thank you.
Very nice.
Thank you.
Thank you, Maciej. And last but not least, and that looks a little bit strange over there, but it was my fault. So we have got Health and Wellbeing Queensland as a partner organization with the Centre for Information Resilience. Dr. Robin Littlewood is the named partner over there. She's the CEO of that organization. She couldn't make it today, and we knew that Caroline was coming along. Caroline is leading all the strategy and policy work happening at the organization. But it was my fault that I didn't get a bio and a headshot from Caroline, so I just put it on top of what I had.
I'm quite happy to be under Robin's photo, thank you.
So thank you so much, Caroline, for coming along, and I think it's really important for us and for future leaders sitting in this room to look at look at it from a strategy and policy perspective. Yes, over to you.
Thanks, Shazia. I did bring some slides as well. I'm not sure whether I can show them, but
yes,
I've brought a slightly different lens to my other esteemed colleagues here on the panel, and I just love hearing about the work that you do. And I'm coming from the other side of the coin, really with a clinical background and no PhD. My CE, Rod Littlewood, has a PhD and has, I think, graduated from university about 8 times. So we do, as an agency, share a real appreciation for research, and we certainly strategically place that as a priority in the work that we do. So I thought I'd take a bit of a different slant with you all and describe a bit about the agency and the value of research in this agency, and the experience of someone that I actually interviewed just recently about her experience doing a PhD as an industry partner with us and another agency we work with. So I hope that's going to be interesting to you, slightly different lens. But we'll fire away and we can have questions afterwards, no doubt. So just a quick acknowledgement of land and the traditional owners of the land upon we're meeting today, Turrbal and Yagara people, and also acknowledgement of all the lands that we all come from far and wide. And it's really great to be with you today to talk about this. Just so you know quickly where I come from and where Robin comes from, we are a prevention agency, an independent public health agency dedicated to the prevention of chronic disease in Queensland. So a really big mission, a really exciting vision for the agency and the work we do. And we know in order to do that work, we need very smart people such as yourselves who are on the edge of innovation, thinking, thought, leadership. We know that that's where we need to be. So that's why we are so thrilled to be partnering with Shazia and the universities more broadly in industry placements for particularly PhD students. We love you. So what we do a lot of is we target policy, practices, mindsets to shift the dial on chronic disease. And we know that to do that, we have to work in partnership really closely. So we line ourselves up with critical agencies that can deliver to communities and to people effectively. And one of those great agencies that we partner with is Traction. It's a small not-for-profit. It works with underprivileged youth and disengaged youth. And really what it does is so clever. It's in the community and it uses bike building as a lever, really, to engage with youth. And this, rather small enterprise has grown and been proving through good evaluation that it's having an impact on the lives of kids and youth in certain areas of Queensland. So the focus on bike building was great, but obviously with Robin thinking outside the box and with her good relationships with the University of Queensland, and we thought that there's potential to build more into that partnership with Traction and into that program. And so what they came up with was the idea of, well, there's a nutrition link there that we could be really helping these kids learn about how to prevent chronic disease in themselves and eat well and move more and take care of themselves. So we thought, how can we do that? We're a small agency. We've only got about 50 people, maybe 70 now. We're only 3 years old. And of course, there are fantastic PhD students who have an interest in nutrition and innovation, and so would that be of interest? And of course, it was of great interest to this woman, Alana, who has generously shared these slides with permission today. And Alana and I spoke earlier in the week, and which must be yesterday because it's only Tuesday. But Alana described a really powerful story about doing a PhD in this way. And she spoke about, the first thing she said was, my mental well-being has been so much better doing my PhD, and I'm quite sure because the motivation and the reality of working with people in the real world has meant so much and been so healthy for me, particularly through COVID. She was a COVID PhD. So she spoke about those benefits of well-being, which was really interesting to hear. It was the first thing she said. The other thing she said, wrong way. The other thing she said was that she had to learn some skills that she may not have otherwise, but flexibility and adaptability and patience in the process of designing a new program, co-designing, waiting for approvals on things to move, a staff member resigned, a school pulled out. So all these things that she had to cope with, that she said that being in the real world really helped her have a bit of a distance from those issues and a perspective that she may not have had otherwise. So I thought that was really good to hear. And then largely her feedback was around connection, social connection, and these relationships and working with people of very different backgrounds and perspectives, life perspectives, and she has absolutely loved it. And the quality of her work has been fantastic. So she has produced a program around nutrition for these kids and has evidence that it's working. So I think the statistic she left me with, the stat at the end, was 75% of the kids that she's worked with have taken a recipe home and cooked for their families. So who knows where that goes, but it's a good step. And that's all I got. I hope that's just given you a bit of insight into the value for industry, for us, in having your brains. And we so need data scientists, and we so need data. We just need everything in prevention, because we are needing to catch up and use data in a very good way. So that's why I'm lucky to know Rocky and Shazia, because they're also going to help us do that.
H1 is here too, our PhD student working
hello.
with yeah, there we go. So thank you, Caroline. Yeah, I mean, I would just like to echo what Ilana said over there, but just multiply that with 20 or so years. I feel particularly privileged. It's a luxury to work with so many intelligent people all the time, you know. So when you're in research, irrespective of, you know, whether you're in academia or you're in industry or you're in government, if you're in a research unit and in a place where there is an innovation mindset, you have this luxury of working with, you know, smart people, intelligent people, people who think outside the square. Yeah, that's certainly something that I've been very grateful for over several years. Okay, so that was from our panel members. Thank you, everybody, for sharing your experiences. So I would like to now open up for questions. Any question. No question is like, you know, good, bad, whatever. Any question will go. Yes, at the back there.
Thank you for the question. I believe the question being asked is, do I have a sugar addiction? And more importantly, is sugar a problem, particularly with child and youth, and is there resistance to changing that from a political perspective? I would say that the current environment is very much starting to acknowledge junk food advertising and its problems. The UK and the US have just made some kind of significant policy changes, legislating junk food at certain hours of the day, not before 9 p.m, so it's not reaching children as easily. There's an appetite for that, and discussions happening at a national and state level. I think sugar will follow, but there are definitely some factors in Queensland, a sugar industry, and we have a way to go. But certainly the prevention agencies are working out ways to approach that from a policy and advocacy perspective. So into the future, yeah. I hope that answers it without saying too much at the moment. There's a long way to go.
Yeah, I mean, it's a good question because it outlines both the hurdles as well as the potential for impact. There's another very smart person that I know who told me once, nothing worthwhile is easy. So you've just got to get over those hurdles, but then the impact is that much bigger.
And I think worth just making the point that sugar is one aspect. There's a lot about our lifestyle and the pressures around us and the environments around us that make obesity, overweight, much more problematic. It isn't just sugar, and so lifestyle factors, particularly for our kids, is something we're really taking seriously in our strategy and our policy work.
Very good.
And sugar is not bad. It's just how much of it you consume.
That's right. Let's not down sugar.
Yeah, birds eat honey.
Question from you? Yes.
I guess that's a difficult question to summarize, but the issues are, the question was about actually the industry research, and as researchers you tend to end up on a project that will end up delivering some sort of product for the industry partner that you were researching for. This will be sort of guided by some IP that will prevent you from actually publishing on in some sort of high-tier journal. And usually some other work that you might be able to publish will have to be sort of on the lower sort of tier journals due to that sort of confidentiality. It is a problem, I suppose, but it's only a problem if you want to maintain your academic integrity, because in academia, publishing is currency. So if you stay an academic and you want to sort of continue your academic career, then yes, you will be to some extent impeded by that sort of act of given to the industry. However, if you continue your research in industry, they don't really care so much about that. Like our laboratory is slightly different because we do still maintain the sort of academic integrity, so we do a lot of research that actually is just driven by publications and some high impact factors. But we also have various other ways of communicating. You write blogs and you kind of, white papers and so on. We're much more open in industry as well to not just peer-reviewed journals. And different academic streams might look at it differently. The preprints, for example, are better perceived in some sectors than in others. But that's kind of it.
I'll just and then you can. Yep. I think it's not just related to industry, but I think that's something that's really important across the board for all PhD students, is to have those conversations at the start and before you enroll, before you start that relationship, because it doesn't relate just to industry. We find the same in the sort of more academic clinical medicine. We publish a lot, but there may be different expectations between the PhD students, between the supervisor, between the clinical partner around who gets to publish, who's first, who's last, when that publication will occur. And so I think, and they can sometimes be difficult conversations to have, but I think around authorship, publication profile, the timeline for publications is a really important conversation to have up front with the support of your supervisor, because there can be there's a lot of examples where it goes wrong down the track and where you may not get the recognition that you thought you were going to get. And so you don't want your PhD journey to be marred by those sorts of issues.
That's a cracking good question. I had to sit here and stew on that one for a few minutes. I completely agree, and that's what I was thinking as well. I think it's really critical that you obviously know what the intended outcome is from the beginning, and you have those conversations and try and make sure you get sign-off formally from someone who can give you that sign-off. So if you do get blocked later on, you've at least got something you can pull out of your back pocket to say, well, it was the CEO at the time, or somebody, in a senior leadership position at the time, approved this. Surely we can continue. A slight nuance on that is when you go poking around in an organisation's data, you will find things, and they might not necessarily be terribly happy for you to be publishing the things that you find with their name on it. So my study was done in a very well-known hospital here in southeast Queensland. My published papers I don't mention the name. I talk about it being, a hospital facility. I talk about numbers of beds and patients, the kinds of acuity and the care and things. You won't find the name mentioned there anywhere. And it was for that particular reason that the journey wasn't about airing dirty laundry. It wasn't about, pointing out an organisation and going, you did this wrong. It was about the journey, the experience, the learning that I gained that I could give back to the organisation and other organisations around the world that are finding similar kinds of problems and downloading the paper and having a look at it and citing it and those kinds of things. So it's sharing the knowledge, right? But I feel for you if you're already some way down the pathway and then encountering these issues around IP with your organisation. You might need to look at, can you de-identify the organisation, or can you somehow downplay it without watering down your results or your research too much? And again, maybe networking, talk to other researchers in your domain and see how they've handled this type of problem. ResearchGate's a really cool place where you can actually go and ask questions of people that have been there and done that before, I think. So if you did one resource of many, you could go and talk to people about.
I think that's a very good question. And, from more of a national perspective, I think in terms of research industry engagement, there are other places in the world that do better than Australia. Let me put it this way, right? So certainly there is, I think Kristen made some really good points about expectation management and project management, really, which should not fall on the PhD students and certainly should fall on the supervisors and the institute where you're enrolled and, all the ethics and contractual aspects that go with that. So if you're not getting that, you should be getting that. But also, I think, Maciej, I really liked your point about, publication is not the only currency. There is many other ways of innovation, and it really depends on your career path and the performance indicators of your career path, right? And if it is all about patents, if it is about commercial tools, if it is, you go with that, right? And you will still have a very rewarding career, very impactful. So, excellent. Yes, another question. The question is, what sort of soft skills is industry looking at beyond the skills of, deep knowledge that PhD would bring? And let's go with that, and then we come back for second question. Okay.
I guess I'll get the mic. I'll kick this one off. So communication skills is probably right up there, if not number one. You're going to be interviewing people. You're going to be having conversations with people who they're busy. They've got day jobs, and you're wanting to draw knowledge out of them. So you need to be able to relate, communicate, make it about them, about their time and their contribution to what you're doing. Time management skills, that's critical for anything that we do. And your documentation skills as well, making sure that it's clean, precise, and accurate. I'll pass you on.
So I guess my two big ones, it is, and it's not specific to data science, but the relationships that you build in any career are what makes or breaks your career path, I think. And so being respectful of people's time, like you said, but really putting the energy into the relationships that you build, trying to understand when you're a data scientist, you'll often end up in a field where you don't have the domain expertise. Mm-hmm. So putting the effort in to try and understand some of that terminology, some of that language, so you can have those conversations, I think is really important, and that is appreciated, and it will give you respect, gain you respect as well. And then my second big one, I think, is project management. So it ties a bit to time management. I found that I actually went away and got a project management qualification, but I think to learn the basics of it, and because we, as well as data science experts, it's unlikely we'll be working on just one project. You'll be working on lots of different projects. Your ethics will get held up. You're going to move to the next one. Your publication deadlines, and so learning project management skills is going to go a long way in keeping you sane through the rest of your career, but supporting your mental health and your well-being to make sure that you don't take on too much, that you can plan appropriately, you can deliver on what you say, and again, in turn, that's going to build the respect and the relationships.
I actually like the question about soft skills because maybe I'm slightly different in a way that for me what matters actually are soft skills a lot more than hard skills, because if you've got the right person, they can learn anything they need to learn. So actually quite often I rarely really pay too much attention to the CV. Mostly I look at a conversation with the person, and I think for me the biggest factor is curiosity and passion. If you have someone who's passionate about the topic that you're discussing and you're going to be working on, they'll self-motivate. They'll do everything. You don't have to push them. You don't have to shout at them. You don't have to do anything. It's an enjoyable collaboration when you have someone who's passionate about what we do. And so for me, that's kind of soft skills are always more important quite often than actually technical skills. But we all acquire them through the PhD, and we have similar stuff. But time management, I think, is hugely important out there as well, because, of course, it's very different when you in academia, you have long timelines, and sometimes they're kind of very fuzzy, whereas in industry, a lot of it is quite delineated and quite abrupt. So you have to learn how to time manage across multiple projects, how to prioritize them, and so on. But for me, the biggest one is passion and interest and curiosity.
Great point. I think I agree with what you've said, Maciej, very much. The soft skills and that relationship building, we've all touched on it. I think synthesizing information is so important. So thinking about, this leads to many things, but all the parts and an ability to put those parts together, but also reflect. So it's sort of a horizontal and vertical process where you're synthesizing information, reflecting on information, and then being able to communicate that is so important. I also think that a growth mindset and a solution-focused mindset, proactive mindset is really important, and we certainly value those skills in our workplace and our work. So that would be my top ones.
Thank you. Really excellent question. We go back to the second question, and then I will come to you. Yes. Okay. You received the answer already. Okay, cool. Over to you. So the question really was that, PhD is highly specialized. We often talk about the T-shaped individual. We all want to achieve that in our graduate profiles. You got a breadth of knowledge, but there is a big dip, right? And that is like highly specialist knowledge. And I don't know, 200 years of peer-reviewed, culture has created that specialization. Sometimes it's an over-specialization, So the question really is that, if you've got a qualified PhD, perhaps not exactly in, biostatistics or genomics or, pediatric health, but comes with that qualification of methodological rigor and, all of that, would you be open to hiring them?
Yeah, that's a good question. So thank you for reframing that. So I would say potentially yes. It comes back to what you're looking for, right? For me, it's what's the problem domain that I'm looking at, and is it something that I need an answer to now, or is there something that's emerging and I need someone to start to come in and think about it? And that's kind of the space we're in with our two research projects as part of CIRES, right? They're both existing and emerging problems that we need some help with. it sort of comes back. It's almost the soft skills again to some degree. It's what do you bring to the table? How can you take what you've learned or what your specialisation is and reframe it for the opportunity, right? So a lot of that is back on you to know yourself. What are you looking for? What's your driver? What's your motivation? What's going to light your fires? And then try and sell that in an interview to prospective employers. Because definitely our organisation, we would look at more broadly than just one kind of narrow specialisation.
I think, yeah, I agree. I think it's something, though, as well to consider as a newly minted PhD, is sometimes you need to get your foot in the door. So you may not be able to switch direction straight away. But what I think we've probably all experienced is when you get the right candidate who is enthusiastic, does have that growth mindset, you are very willing to give them the opportunities to learn a new set of skills because you want to invest in that person. So you might find that for right now, you come out of your PhD, you want to get your foot in the door, you find a company that you know has the sort of the pathways that you're interested in, start where you can start, and then you may be able to shift a bit. But you want to get in there, get started, start learning, and then explore the opportunities for additional training and a little bit of shifting of opportunities.
Yeah.
Yeah, I think it would also have to be kind of a way of getting to understand why this has happened for you, why you pivoting. So it is then on you kind of to elucidate the path of thinking, what motivates you, why is this motivation attracting you more than your current direction, and there's nothing wrong with that, and it should not impede you if you come to kind of through to the interview and you're having a discussion. You do have to elucidate that motivation. Why is it right for you? What motivates you? Why this passion suddenly came up? Because if it's the right motivation, that's fine. But it could be the risk here is, of course, a random thought comes to your mind. Oh, I'll do this now. And then 5 minutes later, I'll do this now. And and as people who we are hiring, we don't want that to happen. Right, so it's fine to pivot, but it has to be kind of backed up by some sort of logical passion that drives you in that direction, rather than the random thought that an opportunity came up.
So I just had an example. I know a guy who's a mathemagenius. He's got a PhD in aeronautical engineering, or aerospace engineering rather, and spent most of his career as an environmental scientist at CSIRO. So reframed his PhD to use it in a different way, and had a very successful career as an environmental scientist.
Yep. So who knows about the big business software company called SAP? Show of hands. Who knows it? Everybody. It's SAP, right? If you look up their founders, there was quite a few of them who were PhD in physics. Not business software, right? Not even business. PhD in physics. And they set up this, 40 years, 30 years. It's been going pretty strong. Yeah, multi-billion-dollar company. So, Maciej, you make a really good point there. Yeah, it's not a random thought. It has to be a deliberate pivot, right? Driven by your passion. Excellent point. Okay, more questions. Back to you again. So the question is, Australia is not different to many English-speaking countries where we have got, the PhD cohorts. International students are very dominant in PhD cohorts. So what are the opportunities for international students who are sometimes faced with, issues like visa problems and so on? What about their careers in industry and government in Australia?
Okay. I'll have a go at this one. So our organisation has and will in the future sponsor international students. Again, it comes down to what the need is and what the supply is locally in Australia. But we have in the past sponsored students here in Australia. Don't forget, organisations like ours, like Allianz Partners, we're a global entity. So we have there's development in. We've got a data science team in Thailand. We've got software engineers in India, Spain, and other countries as well. So depending on where you come from, there may be opportunities within your own countries.
I also wanted to add to that COVID has shifted dramatically how we perceive who we employ, where we employ them. So the system completely has changed. If you look up at job advertisements, there is a huge number who are remote. Remote is normal now. It's not unusual. It comes with problems, and of course, long term, it's still relatively difficult because you are removed from this social environment. But it kind of indicates that we are much more open to having people on the other side of the world actually working for us. We at Max Kelsen, for example, we did have 2 employees living in London, and they didn't have to move to Australia; they stay there. And as the world becomes more digital, that becomes even easier because everything is online. So I think there is always possibility for the right person. The company will make sure they'll get you. So it doesn't matter where you are, right?
Awesome, very good. Oh, Caroline.
Just to comment on that, we have a lot of students in our agency, undergraduate as well as postgraduate, and from everywhere, all over different countries through the university. So I can't comment on sponsorships from where I sit, but absolutely, that's a given that we love perspectives from people coming from everywhere into our organisation.
That's very nice. Thank you, Caroline. Okay. Kristen, do you want to add anything?
No, I think probably well covered.
Well covered.
Yeah,
Okay.
but I think I guess from an academic perspective, one of our big KPIs is international collaboration. So if there is an opportunity to bring someone into the organisation or have them work remotely or partner with them, and it's an international collaboration, that ticks a lot of our boxes, to be honest. Yeah,
it's a good thing. Yeah, absolutely. Yeah. All right, we still have time for questions. It's very good questions. A question is, how do you value data work, right? Results of analytics may not be something people want to hear. There may be data quality problems that might be, I don't know, stepping on toes. So how is data work valued, right? Okay.
It's a great question, and I think something that we've all probably at different stages come up against around the value of what we can add to an organisation or to a particular project. So I think the first thing I would say, it happens from my perspective formally and informally. So a lot of the projects that we will do will have that built into it. We want to ensure that our partners, that the health service is benefiting from what we do. And so we'll have sort of the implementation, the translation plan built into our projects. We might build the models, we'll test them, we'll evaluate them. And not just from a data science perspective, did they work or did they not? But from how did it work in practice? Was it helpful to the clinical team, or did it get in the way too much? Were they not using it? Did they keep reverting back to their previous practices? Because if we build something fancy and they can't use it, we may as well not be here. So I think that's a huge, and for me being in a more applied role, that's a really rewarding component as well. We don't just build the models, we put them into practice and we see how many kids we can divert from ED and reduce their length of stay in the ICU. So we have very formal measures around that. But informally, it's those relationships as well. So you will get to know very quickly the people, for me, example, in the hospital that are pro-data science and those who are not pro-data science, that may prefer the ways that they've been doing it for a while, which may not include the sort of the cutting edge techniques that we might want to implement. And so in that perspective, you know, you've got a couple of options. You can say, okay, that's fine, that person's going to stay with that mindset, or you build that relationship over time, which is my preferred option, and you get to a point where you can have those conversations with them. And so I think it's important to have, you know, the informal and the formal feedback, because, you know, nothing does beat a graph on a screen that says, look how many, you know, presentations we saved, or look, we reduced the kids' length of stay. But I think as well, just if you do come up against someone in a project that you're working on, an organisation that is not pro-data science, that does not see the value of data, don't take that to heart. That is not necessarily, it could be a reflection on you, but it is probably not a reflection of you. And I think it's not uncommon. It's a changing landscape. There's a lot we can do that other people don't know that we can do, a lot of value we can add that's not clear. And so you will come up against that. And so I think, you know, being able to convey what you can do, how you can improve, how you can help, that you're not going to get in the way, that you can partner, is important.
Good. Nice.
So I manage an enterprise data management team, so dealing with data issues, data quality, data sets, that's bread and butter for what my team does. So we manage it a couple of ways. We have an enterprise data governance program. Data governance is all about managing data risk and trying to make sure that we leverage the value of the data that we have. So we've got lots of processes in place around that. Data literacy is a big part of that, and a space that's still emerging, and we're still working through our organisation and trying to upskill or up-knowledge the people in the organisation just around data in general. From a data analytics perspective, we're still a bit stuck in descriptive analytics. It's very much how many, how much, when, right? How many widgets did we sell and when? Snore, that's boring. We need to shift towards much more prescriptive data analytics, and then getting into the predictive space where AI and ML stuff really starts to bring to its own. So what's happening now? Where should we be? What does the trend line actually look like, not guesstimated? What are the levers that we've got to pull, push, or change to try and correct trajectory so we remain on or above the known target? That's where we need to move towards, and that's the conversation I'm having literally with my team at the moment. And this is what our CEO is looking for as well, is how do we get from what happened last week, last month, last year to what's emerging, and how do I either make the most of it or avoid it?
Very good, and I'm so glad you touched on data literacy there, because we do have a competition tomorrow, and you know, if you're going to write a question on it, you know, you have the correct answers and you have the incorrect answers. How could a particular fact, you know, multiple versions of truth often, but let's say fact, be misinterpreted, right? And then those are your question distractors, right? And it is not uncommon for them to be misinterpreted, and that is something that, you know, leaders like yourself, if we all work together, I think we can help overcome that. So just lift up the literacy levels, right? Yeah.
I don't even know how to answer that question. We are at the very beginning of our data journey, really. As a health promotion agency, we are trying to measure things that are super hard to measure. So our need for data science, we're in the process of identifying what data, and you know, when you're measuring change in the system, so changes to policies, practices, mindsets, networks, you're also being asked to measure change in population, so BMI, physical activity, fruit and vegetable intake, and yet there's no one sourcing that data anywhere. So, you know, we've got some really challenging data and analytics challenges, which is why, you know, CIRES is so important to us, but, you know, and helping us in that journey. Our foundations, though, we also need help to get right, and we've only just recruited a data lead, so we are embryonic in this, but we have a CE who absolutely wants data to drive every decision. At the moment, we're leaning on data that we get from other places that indicates a certain evidence is good, or we're very heavy on the research, but to evaluate our impact and that what we're doing is making a difference and actually is economically viable. And then, imagine getting into precision prevention and prediction and, being ahead of the game. At the moment, we're, really in a space with prevention that we're reactive. But that's the journey we're on, and we're just really getting some foundations right at the moment. So we're going to be needing more and more of what you do into the future for the purposes of prevention for really good causes. But you're hard to get, so just remember agencies like us in a few years, because we'll be recruiting, I hope.
I think my company is kind of quite advanced in that space. But I wanted to create a distinction between the research that we do in that space versus the commercial side of the business that does consulting. So if you on the commercial side and you work as a data scientist there is a problem that's proposed by a client. Client has a particular question, quite a particular problem to solve. You discuss that with a client. What is the solution that they'll be happy with? And that's drawn up a bit ahead of any analytics that happen. And so then those processes is just being put through the team, and the whole team works towards delivering that solution in the end. On the research side, it's slightly different because the questions are more grandiose and long-term and more ambiguous, with higher risk of no outcome or no successful outcome. And and then there is a huge importance of having experts who have very slightly different know-how about the data. So you still need mathematicians, you still need people who know how to numerically make it secure, how to numerically deliver that. But you also have to have a data scientist who knows how to code that into a really efficient algorithm that can actually save time, because some of this data that we work with, genomics data, multi-omic data, right? So we have a lot of issues with huge amount of data that's really heavy, complicated and multidimensional. Computational costs are huge, take a long time. You run something for weeks on end to find out that, actually it didn't actually, optimize because something. So you kind of constantly have to navigate that with people, not, the same as with managers of database management. But so kind of coming to that point, everything is super important, and this multidisciplinary conversations are constantly important. The experts, domain experts, always have to come into the conversation, because I'll be looking at something and it makes no sense to me, but the domain expert will know it makes sense, and it will help me guide how to change that algorithm or improve that algorithm because of the domain knowledge that they have. So they're guiding us to deliver that sort of final sort of analytical package. But also the understanding and appreciation for the importance of data, it's still fairly new. So a lot of companies do not understand just how valuable it is, the data that they sit on. They're sitting on gold mines, virtual gold mines. They have so much incredible insights. They have no idea. And they're just collecting it. But now it's time where actually more and more companies are waking up to the fact, well, I've got all that wealth of information, but I have no idea what it holds. So it's time to start.
Very good, very good. Deep insights. I think we still have time for 2 more questions. So first, so the question is, with PhDs, when you apply, you could get knocked back as being overqualified, or you need 10 years of experience. So how do you navigate that?
Yeah, I think it's a real problem. I mean, it's I don't think it's necessarily just specific to this here, but I think, you know, it's important to try and when you're towards the end of your PhD in that sort of last year or so to start reaching out, to start making connections with the companies, with the organisations that you might want to work with in the future. Try and, I mean, I know as a PhD life is busy, but try and see if there's any projects you can help out on. You can, you know, any sort of work that you can get started on, and then you're going to be more attractive to them when it comes to that. So you may not have the 10 years of experience, but at least they know you as a person, they know if you've got passion, they know if you've got good time management skills, and so you've got a better chance of getting that role than if you go in there cold. But it's not, I think as well though that you're not always going to win that one as well.
Anybody else want to, Caroline? Yeah.
I just comment on the industry placement and the fact that that gives you so much in terms of that rounded experience and those skills that can, you know, at the end of it, you end up, you know, I think with a really rich experience and confidence that will help with those, you know, future manoeuvres that you might make. And that's certainly when I was talking to Alana, you know, she presents to me as someone who hasn't had a lot of experience in terms of working life, has gone from university, sort of undergrad to masters to the PhD, but she struck me as someone who has been able to almost have lived experience through the work that she's been doing through her PhD. So it's almost like it's a win-win situation, I think. Those kind of placements are really good for rounding people as well.
Yeah, and I think institutionally and nationally, there is a recognition of this need. It's the most highly qualified people in the country, you know. Are we training them in a way that they are not naturally, you know, going into industry and government research, right? And it's a small country, you know, so there's a limited number of academic positions, and also sometimes academia doesn't always align with your interests and your passions. So schemes such as the industry training centers, many linkage projects, including in medicine, you know, there are schemes which have been initiated by the government from Canberra. Somebody's thought about it. Even at undergraduate level, there is lots of talk on work integrated learning, where students are actually placed on premise with industry partners, and yeah, totally agree that that's a fantastic way of mobilizing, you know, those relationships. Yeah.
Yeah. I just want to add in there too that we're not always looking for PhD graduates for commercial roles necessarily. We won't be going out saying, I'm only looking at a PhD graduate. We're looking for the right fit, and often it's culture, not necessarily the hard skills. Even it's those soft skills again. Mm-hmm. So it's you know, when you're searching for roles, when you're searching for the kind of job that you think you want to do, making sure that you do answer the selection criteria, or, you know, have a nice cover note to try and address what they're looking for in the job ad. Not necessarily, hey, I'm a PhD, right? You still got to target what's in the job ad. Whether it's you're a PhD, whether you've got, you know, six degrees, doesn't matter. It's that same, or 400 certifications. It's that same piece, right? You need to sell yourself to the position that's there. If you're struggling to get experience, one way to do that is to get into community. Are there communities that you can get into to do some volunteering work for, or maybe they'll pay you a small stipend or something, where you can build that network? Because often people who are in communities have businesses, or they're working for organisations like mine and like others, where you might be able to find an angle that way, or you can at least, you know, when you put your application in, you can say, look, I haven't been a manager, but I've been managing teams as part of this community outreach group, or whatever you might be doing. So there's always different angles that you can use for these things to demonstrate experience that you have, even if you might not realise that you've got it.
Yeah, that's a lovely idea. Yeah, so the question is that, H1 is working with, so it's a CIRES PhD, working with Health and Wellbeing Queensland, and Rocky here is a supervisor. And so the question is, we are building machine learning models. Of course, we are looking at the data capture issues, which is the sparsity of data. We recognize that that's a big challenge to overcome. So building machine learning models for various predictions. Of course, that requires deep domain knowledge. So H1's question is, how do we bridge that? How do we bridge our data science knowledge and the domain experts that we are lucky to have access to because of this relationship? How do we navigate that? Yeah.
I don't think that concrete example about how they work together.
Lots
Concrete
of coffee
example.
together.
Concrete example. Well,
Yeah.
maybe I'll have a go, but it is certainly challenging because every domain expert speaks their own language. So when you bring the disparate fields together, they just don't understand each other. But and it's painful. Like the first meetings, that sometimes you go into the room and it's just awkward. And I was like, well, you could be speaking to me for the next 3 hours and I still have no idea what you're just talking about. But but the thing is, you have to push through that pain and meet again and meet again. And what you'll see that within a very short period of time, there is a buzz going on, and suddenly there is an exchange of information, and everyone is. Of course, always there has to be a central question that everyone is driving the same direction. So we need to know what the objective is. The real world problems or real world machine learning. I mean, that's kind of a phrase that's a little bit silly, but it is just about practicality of it being implemented in practical world where it can actually do something. It's not the intellectual exercise of developing something new, but actually implementing it so it maybe improves health. Right. I think the most important aspect is time and communication. Just go through the pain and awkwardness, and spend some time with the people. Get to know them, and you'll quickly realize how much you're talking about the same stuff, but with different language.
I was thinking as well. Immersing yourself in the domain that you least know the most, as much as possible, will help. You won't master it. Well, you might not master it, but you'll get a better gist of what's going on, and then doing your own research on that domain to help fill in some of the blanks. If you can find a buddy, someone who can provide you that domain support through the journey, even if it's for a little while, to help, what do they mean by blah, or I'm not sure about such, and they're quite happy just to kind of help with some of that information. Be careful though that you don't overuse that connection and start expecting them to drip feed you everything, because that will start to wear on their time and their temperament somewhat. So again, you need to contrast that with your own reading, with your own research, find some books, whatever, to help augment what you're getting through your contacts. But if you can find a buddy in that domain, that will help. That will help a lot.
Caroline?
I think, Henchman, we should get some time together, and I absolutely agree. I think clarity in understanding what we're working toward together is so important. And certainly there are so many helpful people who have deep expertise who can assist. So that's what we need to do together.
We're very lucky to have Lee Kang.
Very quickly, just a concrete example came to my head. I'm a statistical geneticist, but like I mentioned, I'm supervising a team of quantum physicists. So that was a pretty difficult breaching point where I remember my first time I sat down in the meeting room with them. I have never heard words like qubit and transmons and superconducting stuff. So all of that was pretty superpositions and all of that sort of stuff. But I agree that you take on, you don't know anything. You understand that you don't have to. You're not there as the domain expert from that specific field. You're there because you are an expert in your field. And so your contribution will be coming from that, but you do have to go out of your way a little bit to acquire that information as much as you can. So, I sit on the advisory board for Centre for Quantum Dynamics. I'm not, by no means I'm a quantum physicist, or I understand it in any depth, but I understand enough to navigate with physicists around the strategies of what they do. But that's down to actually spending a lot of time reading and trying to gain that domain knowledge enough to navigate in the space.
And I just think a couple of other quick points. I agree completely. I would immerse yourself as much as you can. I will go and I will sit myself in the intensive care unit, and I will have access to them. You see what their days are like, how busy they are. When you're not getting those responses, you know why it is. But I think a couple of things. Don't be afraid to ask what you think might be silly questions. I think some of the best conversations I've had with clinicians is when I go, look, I know it's not my area of expertise, but what do you think about this? And you might be framing it in a way that they haven't considered before, and suddenly they go, oh, yeah, I didn't think of it that way. And so what you think might be a silly question has actually opened up a whole different way of looking at the problem that you're solving together. And so I would definitely not be afraid to ask those silly questions. And I think the other thing is that these are all the way that what we've just talked about is really great ways to get to know people and your domain expert. But there are formal ways as well from a research perspective in how you can gain consensus on a particular topic, particular parameters that may be useful for your models as well. So make sure you, particularly in a PhD, in a research setting, tap into those techniques and methods as well, so that you can be sure that you're representing the views of the broad audience rather than necessarily the one or two people you might be getting really close with.
Yeah, Hachan, thanks for asking. I mean, we really have to acknowledge that is no easy. It's non-trivial. It's no easy. And there are no shortcuts, pain, that's what Maciej said. Exactly. Data is always going to be about something, right? So in order for us to make sense of that data, we have to understand the phenomena that it represents. So there's no way around it. A few months ago, we were just having fun, all the CIRES PhD students, and I saw this quote, and we put it on the blackboard, remember, a whiteboard, which said, individually you can have incremental outcomes, and collectively you can have exponential. So let's aim for those exponential outcomes that comes with collaboration. Yeah. All right. So I think we have taken up the entire time, so that was fabulous. I thought we might finish early. Thank you very much, everybody, for your attention for a long day. You still have about half an hour just to sort of chill for a bit, and then we will meet you for dinner at Patina. But before everybody heads off, please can you join me in thanking our panel members?